Hi, I'm Peter. I'm currently the Chief Health Officer at the Maine Center for Disease Control and Prevention. I learned about the LungCaps website at a stakeholder committee meeting. After I left the meeting, I went back to my office and looked at the LungCaps website. I began to draft a memo to my employees detailing how each of them could play a part in the LungCaps initiative. I appreciate how easy it is to find information for providers. After my initial visit to the site, I later remembered that my community outreach employees could provide resources to patients and caregivers. So I downloaded those materials as well.
Hey there, my name is Jessica. I have served as a representative in the Maine House of Representatives for the past 8 years. I learned about the LungCaps website at a stakeholder committee meeting. During the meeting, I pulled up the website on my iPhone. I quickly looked at the website and appreciated that the navigation menu was easy to use. When I got back to my office after the meeting, I pulled the site up on my computer. I used the clearly marked navigation tabs on the website to identify specific information that would be useful for patients, caregivers, providers, and payers within my constituency.
My name is Erica, and I'm currently the president and CEO of FreeMe from Lung Cancer. I learned about the LungCaps website at the stakeholder committee meeting. I looked at the website on my phone during the meeting and started to brainstorm ways I could disseminate the information through my social media networks. After the meeting, I returned to my office to review the site more closely. I was happy to find resources specifically for lung cancer patients and their families. I will show the site to my cancer support groups and ask for their feedback on resources and information.
Hi, my name is Paul. I'm the president and CEO of Maine Health Management Coalition, where I'm responsible for overseeing the organization's activities. I learned about the LungCaps website at a stakeholder committee meeting. After the meeting, I pulled the LungCaps website up on my computer and quickly clicked through the tabs. I made note of what tabs may be relevant to the different groups that I deal with.
Hi, my name is Dave. I have been a cigarette smoker for most of my life. I became concerned about my health after talking to my son. I have had some bad coughing bouts and shortness of breath lately, so I went to see my doc. He recommended that I get screened for lung cancer because I met enough of the qualifications. I went on the internet to learn more about lung cancer screening and tried to find other people like me. I found the LungCaps website and their screening resources.
My name is Emily, and I have been cancer-free for 10 years. I have experience working with the Maine CDC and other local lung cancer awareness organizations. I heard about LungCaps through a friend at the Maine CDC. I was intrigued by what LungCaps was doing for the Maine community and those at risk for developing lung cancer. I checked out the LungCaps website for more information about educating people on lung cancer screening eligibility guidelines, and ways to prevent lung cancer. I intend to use the website to educate myself and others.
Hi, I'm Christopher. I worry a lot about my father's health, so I went online to search for information. I want to help him, but I know I can't force him to seek help himself. I found the LungCaps website during a search for information about resources and preventative services for lung health around Maine. I learned all about lung cancer screening from the website. Based on the information I found on the website, I think my dad is eligible for screening.
My name is Virginia, and I have been looking for new treatment options for my husband who has lung cancer by doing some basic internet searches. I found the LungCaps website and was intrigued by their initiative to develop, implement, and evaluate innovative treatment programs. I found patient testimonials who have used the treatment programs and got connected to additional resources around the state. Being a caregiver is stressful, but learning about resources and reading testimonials from other caregivers is helpful.
Hi, I'm Dr. Blanford, and I practice medicine at the Portland Internal Medicine Clinic in Cumberland County, Maine. I learned about the LungCaps website through an oncologist that I referred a lung cancer patient to. I spoke with the oncologist about how there had been a steady stream of lung cancer patients over the past few years and how increased screening could help. I examined the website at work and was intrigued by the Providers tab. Next, I became interested in what my patients would view on other tabs. I was very excited about the program and brought it in to my nursing staff the next day. I wanted to show them the website. I asked them to mention the website to patients when they visit the clinic.
Hi there, my name is Dr. Cindy Brown. I had a busy morning performing 2 replacement lung surgeries back-to-back without a break. I was about to take a lunch break when I saw a pamphlet on the break room table about lung caps. I picked it up and Googled the name using my phone. At first glance, I couldn't discern what lung caps stood for and assumed it was a purely educational website. I felt like I already knew everything about lung medicine. I was unimpressed with the site.
Hey, my name's Linda, and I'm the Director of Quality Outcomes at Anthem Blue Cross Blue Shield of Maine. I work with a large set of data and often discuss cancer outcomes in the patient pool. During a meeting this morning, I learned that lung cancer is the most prevalent cancer in men living in Maine. Later at the gym, I continued to think about this information and how unfortunate it is that a preventable disease costs so much money and is a burden to so many families. I thought about my uncle who was a smoker and who died of lung cancer. I began to brainstorm ways to combat this. I Googled lung cancer prevention, and the third organic hit was for lung caps. After working out, I returned to lung caps on my laptop and found the Payer tab. I was so thrilled to see community resources. I printed out a bunch of stuff and brought them to my next meeting with a cost breakdown showing the break-even and the profit margins for covering part and all of lung cancer screenings for eligible Maine beneficiaries.
Hi, my name is Rick, and I am a customer service representative at the Maine Medicare office. Today, I took a call with an elderly man who is also hypochondriac and uses many health services. The man, who is not a smoker, feared that he may develop lung cancer and wanted to talk to someone from his insurance team who can help him decide what to do. The man had already done some research, asked me about Maine lung caps, and asked if he should consider joining the program. Normally, I am not supposed to entertain such conversations. However, I hadn't heard about lung caps and I was eager to learn more. After work, I found the website and was very interested. I began to wonder if I should get screened for lung cancer since I used to smoke.